Hi, this is Dave Holloway. I'm a nurse practitioner with Critical Care Transport, working with Lisa Lorenz, who's also a nurse practitioner and the clinical educator for Critical Care Transport. So some background, we have about 100 team members, including nurse practitioners, physicians, nurses, paramedics, CT scan technicians who work on our mobile stroke unit, and contracted EMTs for our mobile intensive care units. We have 7 bases of operation across Northeast Ohio. And historically, our education events have been focused on attendance at main campus. We use the Simulation and Advanced Skills Center quite extensively. However, we've found in the past couple of years that this has presented a number of scheduling and logistical challenges for our team. So we explored using virtual reality and mobile simulation as additions to our education program. So virtual reality, we found this to be cutting edge. There's potential for this to be distributive. It seems more immersive than our typical simulation events, which included mostly the use of task trainers and some high fidelity simulations with human patient simulators. And we were also interested in exploring the social impact of virtual reality. Some of our simulation events are impacted by team members who maybe have not interacted with each other for quite some time. So we found that that was impacting some of our learning objectives. So how we implemented virtual reality at CCT, we developed a work group that included our clinical educator, safety and quality coordinators, the nurse practitioner manager, and our physician leadership. We developed objectives, and we developed VR-specific pre-brief and debrief checklists to help guide us through these sessions, and we began by trialing cases from the VR library to select the cases that we are going to use for the learners. We also explored using mobile simulation. We found enhanced realism as we were training with CCT equipment, and our learners can attend while they are already on duty, so it reduced the need for them to come in for an additional day of training. We chose to do this at our Wadsworth base. It's the furthest from main campus, and this supported 3 of our 7 on-duty crews being able to attend. So far, we've had 5 virtual reality sessions with approximately 48 learners, which is about 50% of the team. Very positive feedback. Some lessons learned included the optimum number of learners per scenario, orienting in the scenario versus the sandbox environment, and our learners found it beneficial to observe virtual reality training prior to participating. We've had 2 mobile simulation sessions for 2023 with 15 learners participating. The initial feedback has been very positive. The team has requested more mobile simulation events, and we're still evaluating the lessons learned. So our next steps in this project will be to continue to schedule virtual reality sessions running concurrently with our core training events, explore new virtual reality cases, including pediatrics, trauma, and OB emergencies, continue to schedule mobile simulation sessions for 2024. We have an ongoing evaluation of the efficiencies gained in our overall education program, and we are evaluating possibly publishing this project and presenting podium presentations at transport conferences. Thank you.